This is one of the case that I like to say. This is the child, as a 10 days old child, is multiple congenital contracture. The arthrogryposis child has got bilateral dislocated hip, congenital dislocation knee, and the club foot. That we treated with the manipulation, sequential open reduction of the hip, and the hip behaved everything well. That's most of the time it's okay, reasonably okay. What happened? The child fell down at 4 years of age and had got the radius fracture. This is available X-ray, and got with the closed fracture, closed radius fracture, and treated with the plate osteosynthesis. Is it okay or? Yes, it's treated with the plates. And as the child was in regular follow-up, they said, why can't you do the implant removal? So after 1 year, we did implant removal. So after the 1 year following the plate osteosynthesis, it was okay.
So you remove, all the plates are to be removed, and once the fracture heals,
yes,
or 1 year is the time when it's reasonable to remove the plates.
Yes.
Absolutely.
Yeah, that's fine. So it was okay, except, and we protected with the plaster actually. The 6 weeks we protected with the plaster. Child, we removed the plaster after 6 weeks. Child fell after the 8 months following the injury and got the radius fracture. The Viraj has got the case of the ulnar fractures. But as a part, we generally be very conservative, less than 10 years of age. We put the plasters, and we see immediately after the plasters, see the 1 week, 2 weeks, 3 weeks follow-up. And child got the reasonable union after the 6 weeks of both the radius. It's not ulnar was fine. It's okay?
Yes.
What happened that after following 2.5 years following this last event, child fell down again and got the both fracture radius and ulnar. And if you see the last fractures, it was at the end of the plate. It's a distal third fractures. Now it's got the plate of the radius is the middle third, lower third, and the radius and ulnar both are broken. So, anything, how can we treat?
Yeah, so how many of you just want to give plaster again? And any place for nailing, thinking that, protect it more and put intramedullary nails as we do for OI.
Sandeep?
Prophylactic nails, Sandeep? The behavior.
Okay, so we thought about that, putting about the cast, and this was the cast. Exactly, we followed the same. The cast has been put. The child has got the 6 weeks. We removed the plasters. And 1 week we followed that. The 6 weeks the plaster was reasonable. There is a callus formation was there, but the story doesn't end here. Child fell down again after 3 months.
And this time it's ulnar fracture.
It's only ulnar fracture. Radius got united and got the ulnar fractures. So, but this time they were said recurrent fractures. So anything else you can think? So we did the ulnar nailing actually. We did the ulnar nailing, and ulnar went 6 weeks. It's got reasonably okay.
And it's in the same limb, monomelic.
Yes, same. It is not not the other parts. What happened that 6 months later, child fell again. Yeah, they don't play the knee. Now what to do? That's the angulation. The child is around 10 years.
So is there a metabolic workup? Did you work up this child for why?
We work up it's having the multiple congenital contracture child, but all other parameters were normal.
And his elbows were fine. They were not contracted.
No, there are no supracondylar fractures. The problem with these fractures is it's a radial bow is there, and there is a proximal third fracture. Even though you want to put any intramedullary devices, we have to do the osteotomy. And that's exactly that. We did it that level and got it corrected and put that plaster, and it's reasonably okay. Okay, the story doesn't end here. 6 months later, he fell down again. Okay. And it's now child is not having any fractures, is fine. But the learning point here, there are reports are there. If you do the open reduction in a child less than 5 years, there are high chances of the refractures. The refracture chance getting double if you do the open reduction. So do not do the open reduction if it is not indicated in the younger child, particularly less than 10 years. And there is a higher chances of the refractures after the open reduction. It is always necessary to do follow-up. Actually, I have seen the more than 10 cases of refracture of the forearm. Actually,
Right.
it's always do the follow-up, because to detect such cases, as Taral said, we thought about two diagnoses. That is very common to have the metabolic workup in those cases like OI, but case is a multiple congenital contracture. With multiple congenital contracture with osteogenesis imperfect, that is called as the Bruck syndrome. We investigated for that also, but the child doesn't have that. The child doesn't have the Bruck syndrome. And the refractures, you can't have that. Once you put the nails, you will not have the refracture. Refracture can happen with the nailing of the both bone forearm. Okay, thanks.
But the incidence would reduce.
Yeah, incidence will reduce, but still it can happen.
It can happen.